are live.
Live. Awesome. We are super, super duper excited today for this live because we are speaking with Dr. Kendra Pope, who is one of only 4 integrative oncologists in the USA. And we're going to be talking all about pet cancer prevention. It's an incredibly important topic because according to the AVMA, 1 in 2 dogs are actually diagnosed with cancer over the age of 10. At the same time, studies do show that 90% of cancer is actually preventable. So while cancer might not always be preventable in our pets, there is definitely so much that we can do, all of us pet parents. And we've been raising awareness on this topic for about 5 years already. But today we have the incredible opportunity to talk to an actual integrative veterinary oncologist. That's a first for us. So thank you so much for joining today, Dr. Pope.
Yay! Thank you guys for having me. Thank you for sharing me with your community and letting me to spread some more awareness and education and just little info facts for them to have and make some different choices with.
Yeah, it's honestly, like, it's so nice to be able to learn from veterinarians like yourself on how to actually help prevent diseases instead of just getting help in when it's ready to, like, when we're ready to treat a disease. So as you mentioned a lot in your content and the education that you're doing, prevention is the best cure. So
yeah, absolutely. Yeah. I feel very strongly, and anyone who, like you said, listens to my content, you'll hear me say it over and over again. The only cure for cancer is prevention. And that's why this is so important. That's why this messaging is so important. That's why sharing this information is so important, so that people understand that this is something that they have way more control over than they really think that they do. And that this idea that if we spend more money and do more research and find new drugs, that we're going to find the cure for cancer. We have already found it. It's to not get it. So that's what we need to be focusing on.
yeah.
Yeah.
So before we get into the nitty-gritty of this topic, maybe can you just take a moment to introduce yourself and what you do as a integrative veterinary oncologist?
Yeah, I would love to. So, for anybody who maybe doesn't know what an integrative veterinary oncologist is, I'll just briefly kind of tell you the differences. So after I went to veterinary school, I did specific study just for cancer care. But during that time, I was really getting familiar with a lot of natural and non-traditional therapies. So things like nutrition and herbs, dietary supplements, acupuncture, using nutrients at really high doses like vitamin C, vitamin D, using other therapies like ozone or microbiome restorations, laser therapy, and kind of just adding to my toolbox with all of these non-traditional tools. And so the biggest difference that an integrative oncologist does than a conventional oncologist is kind of where their focus lies. So the analogy that my clients will always hear me use is kind of this garden analogy of a weed in the soil. So think of cancer as a weed, and our conventional oncology treatments, things like radiation, surgery, chemotherapy, they focus on the weed. They cut it out, they burn it out, they poison it out. We're just thinking about the weed. They're not addressing the soil. What the integrative oncologist does is they think about what went wrong in the garden in the first place that allowed that weed to grow. And once the weed is gone, what do we need to do in that soil to fix it, to keep it from ever coming back again?
Yeah, that's amazing. Honestly, a lot of, like, over here in Dubai, there's no holistic vets even. So
Yeah.
a lot of the times, I feel like holistic is also a word that gets thrown around a lot, but nobody really knows what that entails sometimes.
Yes.
And integrative, maybe you could, like, kind of explain also the
Yeah.
between integrative and holistic as well.
Sure, because I think a lot of times people think holistic means homeopathic. Like even here, people will call me a homeopathic vet, and I'm like, I have no training in homeopathy. So the word holistic is a bit of an umbrella just for therapies that are considered more natural or non-traditional, maybe rooted in more traditional therapies like Chinese medicine or Ayurveda or other traditional systems. Also, instead of reaching for pharmaceuticals, maybe reaching for a more natural therapy, which, although some people would be like, why would you do that? We're so advanced now, we don't need these. Even in cancer care, the majority of chemo comes from natural substances. So we've been using these natural substances for thousands of years because they've been very beneficial to us. And only for about the last 200 years, 150 to 200 years, have we like abandoned them. So it's not that one is better than the other. It's that we can just expand our toolbox by having more, and we reach for the one that works the best and has the least side effects. So integrative is when you're kind of using all the tools in the toolbox, where some practitioners might only practice conventional or only practice holistic and kind of don't do both at the same time. When you're talking about an integrative approach or like a naturopathic or functional medicine approach, it's more about using all the tools in the toolbox and getting to the root cause of the problem, not just treating the symptoms. So, for example, you bring your pet in, they have diarrhea, you're given a medication to stop the diarrhea. You're not figuring out why they have the diarrhea and fixing that so the diarrhea never happens again. So it's switching from symptom management to root cause management and eliminating the factor that caused it in the first place.
Yeah, that's a really good point.
Amazing.
Yeah. And also a lot of the times the side effects of the medication for the diarrhea will be diarrhea. So
yeah. And that's like the big thing that I think really is eye-opening to owners is that, it can be a little bit uncomfortable to think about making this switch because most people, at this modern day and age, we've been raised that antibiotics and pharmaceuticals and medications are the standard and they're normal. But there's really a lot of things that diet changes, food additives, herbs, supplements can do to kind of avoid those medications. Not because medications are bad. I absolutely use medications in my practice, but I only use them when I have to, because a lot of times our natural agents can do what we need the others to do. And just like you mentioned, a lot of the most common medication we use for diarrhea is something called metronidazole or Flagyl in the United States. I don't know if that's the same one that's used for you guys. Yeah. The thing that's interesting about metronidazole is it's actually rarely used on the human side because it's known to cause such significant dysbiosis, meaning it kills all the good bacteria off with very few doses of it. So it's actually used to obliterate the microbiome prior to a fecal transplant in people. So if every time an animal gets diarrhea, we give them metronidazole, we kill off all the good bacteria. So then the bad bacteria grows more and more and more. And then they get more diarrhea. And then we give them more Flagyl and they get more diarrhea. And we just end up on this cycle. We're on this medication for weeks. Whereas if we had tried something like fiber or something like a Chinese herb or something like, a binding clay, we could have done the same thing without affecting the bacteria. So it's about taking all of those into consideration. How effective is it going to be? What kind of side effects is it going to have? How expensive is it going to be? Because a lot of times, if we think about all of those, the natural option is actually the better first option to have.
So true. We see this with metronidazole happening all the time, that circle. But going back, so let's talk a little bit more about like your practice. You have a practice in New Jersey, and you focus on treating cancer patients there. So how many cancer patients would you say have you treated so far at your practice?
Oh my gosh, that's a good question because I wonder how we can quantify it. So because I am a boarded oncologist, when I started practicing after my residency, I only saw oncology patients. But I opened my clinic about 2 years after I finished my residency. And what I noticed is that, we know that cancer cannot grow in healthy soil. The weed is not going to grow in a healthy garden. So these cancer patients, even if their blood work is normal, everything else is normal about them, there's something under the surface that we're missing. They're not healthy. So oftentimes these cancer patients are going to have kidney disease, allergies, GI issues, liver problems. There's going to be something else going on. So I found myself not just treating cancer, but treating a lot of other chronic diseases because the cancer is not going to grow in a healthy garden. And because my wheelhouse was all these natural therapies, I saw that I was not only able to treat the cancer patients, but I was also able to help address all of these other chronic diseases. And so when we opened Prism, my current practice, we don't only treat our specialties cancer patients, but we also treat lots of chronic disease. And then that kind of morphed into wellness. Because what happened is once you're a pet parent who goes through something like this, it's very emotional and traumatic. The obvious next question is, what do I do to prevent this from ever happening again? And so how many cancer patients we've treated? Oh my gosh, since my practice opened in 2017, we have like over 2,000 patients in the system. And before that, I was treating patients for let's see, like 5 years out of medical school. So probably a lot. But what's been really cool is that I've also treated a lot of healthy patients and a lot of chronic disease of other issue patients, because so many of the factors that cause cancer are the same factors that cause inflammation, allergies, autoimmune disease, GI issues, arthritis, diabetes, heart disease. All of these things are driven by the same factors. So it's really like this umbrella network that if you know what to look at under the hood, you're going to prevent a lot of stuff from happening, including the scariest one, which is cancer.
Sorry, we were gone for a second.
No worries. Tech.
Yeah, so that brings us, let's start talking about cancer prevention. So for anyone watching this live, definitely leave your comments in the comment section for us. We will do a Q&A later. And we're also going to start talking about how to help prevent cancer.
Yeah.
And something that I really love is that you actually are now coming out with a course that pet parents can take, where pet parents learn to what causes cancer and how to help prevent it. And we will talk more about the course later. But like I said earlier, I mentioned this earlier already, like, it's so awesome to get this firsthand information from a veterinarian, because usually we only talk to our veterinarians to help address diseases, but getting the information to actually help prevent it is going to be honestly like a game changer. So with that being said, can you give us like the top 3 things that are going to be where you would recommend a pet parent start if the goal is to help prevent cancer?
Yeah. So I know we mentioned we'll get into the details later, but one thing I want to kind of explain and why I felt that this course was important is because there are a lot of general things that you can do to improve health, longevity, decrease risks of cancer. And, some of my colleagues online are doing like an amazing job of sharing that information. Like, what are these cancer fighting compounds? What are these cancer preventing compounds? What can you add to the food? What supplements are good? So there's a lot of information out there about that already. The challenge has always been for clients, and even for myself as a human who is working on cancer prevention for myself, has always been, great, I know all these things can help me, but what do I need? And where do I invest my time and my resources? Because, right, all of us, our 2 most valuable resources are time and money. Like, how do I really know where to put them? And so when it comes to like the top 3 things to do, it's really going to come down to what are the top 3 things that your specific pet needs, because they're going to be different. Now, there are large umbrellas that we know are important for cancer prevention. So things like eating a minimally processed diet, the timing of that minimally processed diet, the makeup of that diet, what is in that diet and the certain components that we are going to want to make sure that are there. That's going to be important. Obviously, there's a lot of supplements that are going to help with inflammation, immune system function, detoxification, methylation, and then limiting toxins, identifying them in your environment and excreting them from the body if they've built up. So all of those topics are important, but how do you know where to start in your pet? So the way to be most effective in these prevention protocols is to identify the weaknesses in the animal. So we all have innate cancer protection mechanisms. Our body actually is producing cancer cells all the time from the time that we're born, and our body is protecting us from that. But when things get weakened, like the immune system, like the detox systems, like the methylation pathways, like inflammation, when those get out of hand, then that's when we can't control those cancer cells anymore. So every animal, because of their genes, their environment, their stress levels, their sleep, their nutrition, those are going to be different. So what's the best way to identify what those top 3 things are is to do a really individualized approach. And that's what the course is going to help with, is to figure out what the specific needs of each pet are.
Wow, that's amazing. Like, honestly, like when I think about it, because there are so many ways to go about cancer prevention.
Yes.
And we've
Yes.
done our research into cancer prevention. We've done a whole cancer documentary on like why pets get cancer. But as you mentioned, like every pet is different. And
Yes.
and their lifestyle is different, what they're eating is different. So what it might look like for your dog might be completely different for another dog. So
Exactly.
it's such a what you just said, it just resonated so much with me.
But
yeah, it can be overwhelming because it's like people want to, like, we want to make cancer this disease, right? That's like in this box, like cancer is here, but like cancer is everything, right? It's a systemic imbalance of all of our systems that's very complicated, where all these levers are being pulled. And that's why it's so frustrating. That's why we haven't found a cure for cancer, because it's not that simple, right? It's ever evolving, it's changing. So it needs to be individualized for it to be effective. And I'm sorry I interrupted you.
I do I guess there is something that I do want to say on this, is that a lot of and this is just actually for overall health, actually. A lot of the times when an animal gets sick, especially our dogs or even cats, right? When they get sick, the first thing that people want to go after is nutrition. So how important actually is the nutrition aspect of cancer prevention?
Yeah. I agree with you. The first thing they want to go after, especially when there's a diagnosis of cancer, I hear that all the time. Clients will come in and they'll be like, I know it was the dog food that caused this. I think that what is a blanket statement that is for sure defendable, and that it would be hard for anybody to disagree with me about, is that the majority of pet food that is consumed is ultra processed. And we know in human studies for sure, and we also are starting to mount them in animal studies, the more ultra processed food you consume, the poorer your health. And that's not because of just guessing. We have the science about why that is, and the chemicals and the compounds and the chemical reactions that happen in our body with the ultra processing of the food and what that does to damage the body. So the food is a big component, not just for animals, but also for people, because the standard American diet, which we call it here, in the West, SAD, most Americans are eating ultra processed. So where, Yeah, so where like animals are consuming these really highly processed dog foods and cat foods, that's what most Americans are eating, and it's happening in the rest of the world too, where the McDonald's and the fast foods and the packaged goods, everything that's been processed multiple times. And so people here will often say it's because there's roadkill in the food, or it's, they want to make these stories about other things that are in the food, which in some instances could be true, but it's not about that as much as it's about the processing. So that's something that like is across the board a problem for animals and for people.
So, as an integrative veterinary oncologist, what would you say is the best type of pet food to help prevent cancer? And
Yeah.
also, with that being said, what do you think about the commonly sold prescription dog food,
Yeah.
or just regular kibble that pet parents can get at pet stores and vet clinics?
Yeah. So this is where it gets nuanced, right? Because everybody wants to know what's the best diet for cancer, what's the best diet for cancer prevention, and it's going to be the same thing. As I know this can be frustrating to people, but it depends. It's going to depend on your animal. So I'll just give you an example because there's lots of data in people about cancer prevention and diets, and probably for all three of us here on live, the diet that's most appropriate for us for cancer prevention is going to be different, because what they actually found is the most beneficial is it's based on your heritage. So where your descendants are from. So like for me, I'm a European descent, right? I'm American. So my ancestors mostly came from like Hungary and Ireland. So the type of diet that I should probably be eating is a Mediterranean based diet. But if you watch these like Blue Zone movies on Netflix, you'll see that a lot of people consumed rice, a lot of people consumed beans, because that's where their descendants were from. Those were the major foods they were eating. So our cancer prevention diets are probably all a little bit different based on our descendants and our ancestors. And so if we had to make that work for our pets, it's also going to be something slightly different for them, with the caveat that our modern animals are much sicker than wolves and wild cats. And so the amount of fat and the amount of protein that they used to consume, some of them can't handle now. But in general, if I had to make a general statement, the things that I will say is that it's always as minimally processed as you can afford. As minimally processed as you can afford, get there. As little processing as possible, that's what we want you to do. Then as low carb as possible, because they just don't need the carbs. Dogs and cats, physiologically, there are studies to show they can process them, but they don't have a nutritional need for them. And then if you want to get fancy, you're going to play with the protein and the fat based on what you're trying to achieve. But really, the two most important things always for me, for health, not just cancer prevention, for health, are as minimally processed as you can afford and low carb, because none of us, including us, need the carbs, except maybe in little tiny bits.
And you know what? I think that's actually what you just said, because there's also research showing that feeding as little as 20% of fresh food actually helps to reduce
Yes.
these markers in
Yes.
adult dogs. So honestly, the main thing is trying to feed as much fresh food as possible. And I would say that one of the biggest differences between fresh food diets, whether it's raw, cooked, or freeze dried, compared to ultra processed kibble, is going to be a lot of the times the carbohydrate content.
Yes.
So
And the processing.
and the processing of the
Yes.
actual food.
Yeah. And something that I learned in my own journey, which I didn't realize, is part of the reason that the carbs are in the ultra processed food is because when they through the processing of the food, there's a process which you guys I'm sure are aware of called extrusion. And in that extrusion process, if there's not carbs added, it kind of gums up the machine and it makes it harder for that extrusion process to go through the machinery. So the carbs are added to make it a little bit easier. So they're not being added for the nutritional reasons, they're being added for the manufacturing reasons. So those peas and those potatoes and those starches aren't being added because they're what's best and healthiest for them to eat. It's because it makes the manufacturing easier and it also makes it less expensive.
Oh man, you're taking me to a whole nother place right now. You're blowing my mind because now I'm thinking about all this research and all these studies. And, we built our store around the data of cancer. We want to do everything possible to provide a safe place for pet parents to shop. And when we think about the carbohydrates that is required to produce pet food or required to produce kibble, rather, it's so high, And then when we look at all of these nutrient requirements, like AFCO doesn't even set a standard for carbohydrates. It's mind blowing. You will not find carbohydrates listed on pet food. The pet food makers don't actually have to list this, even though we are seeing that is causing inflammation in dogs, chronic inflammation.
Yeah. Yeah. We know that carbs do so many things. We know that they definitely affect insulin regulation, which blood sugar dysregulation is a major driver of all chronic disease, definitely cancer. We know that it causes dysbiosis in the intestines, basically imbalance of all those bad bugs and good bugs. Inflammation, like you're saying, which is the joints, is the gut, is the heart, is the every nervous system. So we know that the carbs over and over again are, sugar, right? The sugar is what's driving a lot of chronic disease. Yeah.
And then like another problem with it is with the carbohydrates. And a lot of the times we have all of this grain-free diets versus grain diets. And a lot of the times it's the source of the ingredients are still bad a lot of the times. So now we're talking about the number one used pet food ingredient is actually corn, right?
Yeah.
And then if it's not corn, it's going to be an animal protein whose number one diet is corn. And then 90% of corn in the US is genetically modified. So so many things, building blocks and things that are actually wrong with ultra processed pet food that a lot of the times, even if you're looking at the ingredient list, it's really the processing, like as you said, that's causing so many health concerns in our animals.
Yeah, it's so true. And I'm glad you mentioned the GMO, because I actually was in Bali for a work conference last fall, and I forget who I was speaking to. But the majority of soy in Asia is from the US, which I was shocked to find out, because the US is the major producer of soy, corn, and I guess wheat, but all of it is GMO. And so that's one of our major exports to the rest of the country, where you would think they would be eating non-GMO ingredients. So even if you're like, oh, well, that's the US, we're the major exporter of all of these dried products, all of these ingredients. So, for anybody who doesn't know why we care about GMO, is because one, they're genetically modified, so their nutrient profiles are not going to be the same. And we wonder about that interplay with the body of how healthy that is. But the other major kind of concern with GMO products is they're usually heavily laden with pesticides. And many of the pesticides that are used here in the United States are being banned in all parts of the world. Europe's banning them, even small countries. Where was I just reading the other day that this tiny little country banned glyphosate? And so, the majority of our crops are heavily laden with pesticides. They're genetically modified. So this corn is already sick before it's even being processed. So you're mixing toxins with ultra processing, and you're creating like this stew of just like assault on the body. It's very different from the corn we used to eat.
It's, oh man, geez. Like, honestly, when I hear this country bans glyphosate, which is such a harmful pesticide that has been found to be carcinogenic, right?
Yes.
It's banned here in the UAE, right? So it's here in Dubai, but you have all this pet food here that is made in the US or wherever it's made, they're using, they're feeding the animals the proteins corn that is coming from the top producing countries, the United States, Brazil, and these countries that are producing over 90% of GMO corn. So it's mind blowing. And I don't have the data right here, but I know that dogs are testing so high for glyphosate levels in their urine.
Yep, exactly. Yeah, they totally do. We run them all the time in my practice. And the reference range that the lab uses for dogs is different from people because they know it's higher.
Crazy.
Yep. Mm-hmm.
Wow. Thank you everyone who's watching live. We do see your comments in the comment section, and we actually did get a lot of questions about nutrition. We've pretty much gone over all of the questions. One thing that Danae mentioned was regarding fresh food, should it be grain-free? I think we kind of touched on that. As you said, it should be the least amount of carbs as possible, which would make it grain-free, right?
Yeah, I think that what I tell owners, because it can get very scary, because there's obviously these studies and doctors that will say grain-free is bad, grain-free is scary, and then they tell you to go on a grain diet. Grains and carbs aren't always necessarily the same. That's like, think about them differently. And grain, if you look at the research about these diets and why grain-free is bad, is because they link them to cardiomyopathies. But what the actual diets, and they've done follow-up studies about this and published them since that first study, is they were primarily legume-based diets. So beans, peas, beans. And what we know as people who think about nutrition about beans and legumes is they're called anti-nutrients. If they aren't cooked the way that they were originally made to be cooked by our ancestors, you soak them overnight, you cook them all day long, you're pulling out all those lectins, which are the inflammatory parts of the beans. You're getting rid of them before you eat them. If you don't do that, which is not done, who's soaking the beans and pressure cooking the beans before they go in the dog food? If you don't do that, they have all these lectins, and the lectins behave as anti-nutrients. And what that does is it blocks the absorption of other things like amino acids like taurine. So the answer to all of these questions is it's complicated, right? Like, we want to make it simple so that our brains can like check it off and move on to the next thing, but it's complicated. So there is nothing wrong with grain-free diets if they're complete and balanced from the other way. What you do need to worry about are ultra-processed diets that are heavily filled with legumes. That is what you have to worry about.
Yeah, it's so, like, that is such a major topic. A lot of the times when the grain-free versus the grain, I'm like, a lot of the times it's the problem with processing and still using starches, right? So you're still spiking insulin in the body. So it's really trying to stay away from as many carbs as possible that will not contribute to inflammation in the body.
Yeah. And it just made me think of it because it was something that I just did for myself. I was eating coconut yogurt and my blood sugar was going up. And I was like, this is coconut yogurt. What's going on? And I looked at the back of the container, and they added cassava flour starch to the coconut yogurt to make it thick. And so it's like, if anybody has ever worn one of the CGMs, the continuous glucose monitor, that's the fastest way to like start to think about this stuff, because you're like, holy crap, I thought that was healthy, and then you see your blood sugar spike. And so it makes you really start to think about things differently, because things that you think are healthy or things that you don't think are a problem, you realize your body is recognizing them as sugar, and they're like, wee, all this insulin.
Yeah.
Oh man,
honestly, like, I think, there's like sometimes it sounds like so much for a pet parent who's maybe just thinking of starting this journey of pet wellness, and they can become very overwhelmed, I think. But I think it always comes back to like, start where you can, just do one step at a time. If that means you can just take out some kibble out of the bowl and like put in some raw meat, or maybe even a pre-made raw or something like that, that is a start. So whatever you can do to start is definitely important. And I feel like sometimes when we really get into it, it can seem a little bit
there's a lot.
Well, it's a very good point, honestly. It's a very good point, because I know, like, we get into this because I guess we get so passionate because we see, you know,
Yeah.
the issues that dogs and cats and horses are having, and you're like,
Yes.
well, how do we stop it? How do we prevent it? You
Yeah.
know, as you said, you know, you just need to start somewhere and wherever you're comfortable. So I think to take it back to the statement that we said earlier, you know, just add as much fresh food as possible. Once you do that, you're helping to reduce the disease markers in your
Yep.
animal.
Yep.
Yeah.
And I think the other part about that too that's important to mention is time is going to pass anyways. And the risk of cancer is getting higher anyways. The risk of chronic disease is getting higher anyways. Whether you start today or tomorrow or a week from now or a year from now, you still are going to have to start, because the very unfortunate reality is, because of the changes in our modern society, specifically speaking to cancer, they've done estimates that show by 2030, 50% of the entire world's population will have active cancer. And that's because of the amount of ultra processed food, new chemicals being introduced to the environment, what we're doing to, nature, and all of these things that are changing rapidly that our bodies and our environments can't adapt for. So one option is to ignore all of that. I know people where that's easier to do, and that is an option. But the other option is to be like, this is something that has to happen. So every day I just do one thing that's simple or easy and get started, like you said, with the simple, easiest thing. Because what you will find is, like everything else, it snowballs and it becomes easier and easier and easier, and you're doing more and more. The other thing that's really important about, pet parents being aware of this is nothing that we're recommending is not the same thing we're recommending for cancer prevention in people. So much of the data that I've been exposed to, some of it's in animals, but most of it's in people. Cancer in a human and cancer in an animal is very similar, especially in dogs and cats, because we live in the same environments. So those things that you're going to do to prevent cancer for your animal, you're going to be like, maybe I need to eat less processed food. Maybe my water needs to be checked. Maybe I have high levels of mold. Maybe I'm exposed to too much glyphosate. So they're all going to be the same. So you're going to find that the changes you make to make your pet's life healthier, you're going to find that doing the same ones will do it for you too. And that's really cool, right? Because then it's not just like, I have to make the dog healthier. Like, no, let me do things that makes everybody in my life healthier, because who doesn't want more time with one another?
So can we just, I mean, we've kind of talked about it for a little bit already, but I mentioned this to you previously before we went live. A lot of pet parents often come to us and say, oh, well, the information you provide is great, but I'll get in touch with you once my dog is sick. And we usually just say to them, please, this is not like, that's not why we're here. That's not why we're here about this information. We want to actually help you prevent your dog from ever getting sick, because once your dog is sick, first of all, it's going to be painful for the dog, painful for you to see your dog through that. And you're going to have to hope that there is a cure that might never come. So we always focus on prevention when it comes to everything we offer at PAWDEGA. But why do you think, as an integrative veterinary oncologist, pet cancer prevention is so important, and what kind of inspired you to create a whole course, a whole pet cancer prevention course about that?
Yeah. So it can be hard sometimes to, say, like, why would I invest time now to prevent something in the future that I don't ever know could happen? And that's a relevant point. There's also studies, though, that show that the biggest concern of pet parents is cancer. It's like 40% of the population are concerned about their dog getting cancer, their dog or cat getting cancer. And so the reason to consider cancer prevention now, outside of the obvious of saving you from the heartache of ever having to dealing with that for your animal, is that there are instantaneous, immediate gratification changes that come with thinking about cancer prevention. So cancer prevention is the long-term goal. What are the short-term goals? Well, the short-term goals are that, A, you're identifying the specific areas of weakness and concern in your pet's environment, which are probably going to be the same ones for you too. So is it their diet? Is their exposure to toxins in the environment? Is it something else that's going on that even though they aren't sick, are weaknesses that are hiding under the surface? The reality about all diseases, cancer, all chronic disease, is that there's a continuum. There's this path we walk down. We're not healthy and then have cancer. We go from one cancer cell to many cancer cells. And until we can detect cancer, we have 1 billion cancer cells. And how long it takes for those billion cancer cells to have could be months, years, many years. There's studies that show in people it can take 25 years. So that means that you have that much time to turn the bus around back to health. And so the reason to prevent diseases is because diseases are happening all the time in our bodies. The more we're exposed to, the poorer our nutrition is, the more toxic our environment is, the more junk we're assaulted with, the faster diseases are happening. So it's not really prevention. You're actually treating diseases you don't know you have yet. So it's about investing now to be correcting diseases you don't realize are burning under the surface, to making your pet healthier now, to avoiding veterinary visits for things like allergies and GI issues. Those are the two most common things I see all the time, even though we treat cancer and chronic disease. Everybody has allergies and everybody has GI issues, just like people. Everybody has allergies, everybody has GI issues, and everybody has autoimmune disease because it's all the same problems. So by you preventing diseases, you're actually improving health now, which translates to better energy, more vitality, more time with your animal, less veterinary bills, and you feeling really confident that you really are doing everything you can now to save money and heartache down the road.
Yeah. And, honestly, I can 1,000% attest to that, because when when Milka, our dog, was a year old, she was in and out of the vet all the time. Our vet bills were super high. And once we started to go into that, okay, we did like a whole entire shift, but,
Yeah.
we did the raw feeding, we started supplements, we started toxin reductions and all of that. But now we have barely any vet bills. Once a year, we go and get a checkup. But also something that, like you mentioned earlier already, it comes into your own life as well, right? So now we eat completely different. We use very different products on ourselves than just 5 years ago. And something that I feel a lot of pet parents, but people in general, think is cancer, like, I can't do anything, like, it's genetic. So if my parents had it, then this is going to happen to me, or whatever. So I feel like a lot of people still think that it's so genetic, whereas studies now show that cancer is actually only 5 to 10% genetic, and 90% is based on environmental factors. And that's why I think that's the biggest reason also to look at this now, because we have so much power, as pet parents, and for ourselves as well.
Yeah. And I've even had oncologist colleagues, that when I've shared that stat, they were like, what do you mean only 5 to 10%? And I'm like, look, this is all the published data. It's only 5 to 10%. And that means that your animal was born with a genetic mutation that they will get cancer. But the 90 to 95% of cancers the genes are involved, but what's driving the changes to the genes are environmental factors. So things like, what are they eating? When are they eating? What toxins are they exposed to? How are they detoxifying those toxins? What is their immune system doing? What is their inflammation status? All of those things are what's driving the changes. And so that means that 90 to 95% of them we can do something about. Even if they still get cancer, it might be delayed. It might be less aggressive. It might be more easily treatable. But 90 to 95% of those cases, there is some lever that we can pull to either make it harder or easier for the cancer to develop.
Mhm.
Absolutely.
I mean, it's so true. Like I just when I think about it, you know, human cancer, as we said, and canine cancer closely parallel each other, right? And we as humans, well, not me, but humans eat a lot of processed food, and dogs eat a lot of processed food. And when we hear a lot of the times, oh, my dog breed is prone to this, or we hear in humans, it runs in the family. Like, but a lot of the things that are running in these breeds or running in these families are just like poor lifestyle, right? Like poor food runs throughout the generations of families and they develop the same diseases. So it's not necessarily genetic, it's just a very poor lifestyle of both humans and canines.
Yeah, so there's a term called epigenetics.
Mm-hmm.
And we think that when we think about what we get from our parents, we're like, we get genes from our parents, our genetics from our parents, and that's true. But what the science also shows is that there's something called epigenetic inheritance. So that means if your parents, your grandparents, your great grandparents, there's actually studies in nematodes that show it goes back 8 generations, that the epigenetics, the environments, can be passed on as well. And so there's interesting studies done in certain groups of humans, like Holocaust survivors, that the grandchildren of the Holocaust survivors have higher cortisol levels because of that stress being passed down through generations. And that's not in their genes, that's from the environments. And so when you hear about horrible things like children getting cancer and really young animals getting cancer, and you'd be like, well, how is that their environment? They haven't been alive long enough. Because it's not just the environment here, it's the environment before. And actually the mitochondrial DNA, the like engines of our cells, they only come from our mother and they start to form in our grandmother. So you're talking about these very complex things that we want to make simple so that we can find solutions to them that are not. And so it's about factors that need to start shifting so that over time they're going to have the biggest impacts.
So regarding the pet cancer prevention course that you are now bringing, I think it actually closes on Sunday, right? The sign-ups for that. So who is this for, and who's gonna benefit the most about it, or of the course? And yeah, maybe you can talk a little more about that.
I would love to. Yeah, so we have until Sunday. So we would love to get our last group of pet parents to sign up by Sunday, because I won't be making it available again until next year, 2025, in the spring. So we'd love to have you and have you join us. So basically what the course is about, it's really about everything that we've been talking about. Like, let me give you this information to be able to start shifting your mind and to really awaken you to the reality. It's not what we've been told. This is the facts, and let me show you why it is, and let me show you how much control you have. But the most important part about the course, other than this information, right? Because knowledge is power, but like, what are we going to do with that? Is a scorecard that I've created for pet parents. And what the scorecard is going to allow you to do is take all of these sections we've talked about: nutrition, breed, toxin exposure, vaccine history, spay-neuter status, hormones, all of these categories, and take this big quiz. And you're going to get a number out of 100. And that number is going to show you how high the risk of cancer is for your pet. And so if you get something that's like a 97 or a 45 in your 2 pets, you're going to know that it's very different and where to focus your energy, because each category, there's going to be a range. And if it's one category is really high and one category is really low, then maybe it's not the diet you have to work on. Maybe it's the detox, or maybe it's the environmental toxins, not the food. So it'll help you to identify where are those weakest areas, so that that's where you spend your time and money. Like we talked about, we need it to be individualized and personalized. Along with the lectures and the scorecard, we also are going to have 2 live calls. So with me, everybody gets to come. We get to have this group session, and you get to ask me your specific questions. Like, this is the score I got on my pet. this is what I've been doing. I don't think anything's changing. How do I know? The other thing the course is going to give you access to is direct to consumer diagnostics that you can run at home to evaluate a lot of these things. A lot of these functional medicine and natural diagnostics that I do for immune system health, inflammatory markers, toxin exposure, a lot of the things that I do for those are they're not run through conventional veterinarians. And so I want you guys to be able to access them and be able to kind of see what's happening in your pet so that you can make decisions. Those are the major ones. Can you guys still see me? Now I'm frozen on this screen.
Yeah.
Oh, good. Okay. Can you still hear me talking even though I'm frozen with my thumbs up? Okay, good.
We can still hear you.
That's good. At least it's like an okay picture that I froze on.
Hold on, why is this happening?
Because it's technology and it likes to do that. That's why.
I don't think
That's so weird.
Yeah. Okay, let's hope that.
Oh, something's gonna happen. Well, ta-da!
Okay, yeah.
You
You're
fixed
back.
it.
You're working live though.
Okay.
Oh, okay.
Yeah.
Awesome.
Yeah.
Honestly, like the most, or I don't want to say most intriguing, but the most, the thing that like amazed me about your course the most, I think the entire course is amazing, but the scorecard is really, honestly, it's just something that there's no way for a pet parent to get that much personalized
Yes.
from probably even if you did have a holistic veterinarian to go through, like to educate you on the topic in like a one-on-one session, it would take so much time to go through that. So the scorecard is really amazing. And yeah, it's like a easy step-by-step plan. That's how I imagine it to be, of something that you can do for your individual pet. So yeah, I think that's really amazing.
Yeah. Because everybody wants to know, like, what do I do? And I don't know. What does it need? That's always the question. And I still even get asked that question from other veterinarians. They'll call the practice and they'll say, I have a patient with hemangiosarcoma. What do I do? And I'll say, I don't know. What's wrong with the patient? You need to evaluate the soil, right? So it's about us shifting our mind frame away from the disease and the conventional approach, because that's not how we cure and we prevent disease. That's how we treat symptoms. What we're doing is getting to the root cause to prevent it from happening ever, prevent it from coming back. So to evaluate that soil, it has to be individualized because every one of our soil is completely specific to us. Yeah.
So we did drop the link for Dr. Kendra's course into the comment section. If anybody like to sign up for that, yeah, you have until Sunday to sign up.
Yeah. And the other thing too I'll mention is there's a little mini free training that I offer about the 3 most common myths about pet cancer, and basically I bust them for you. So I know that they have the link for the webinar too. If you kind of just want to learn a little bit more, you're not sure about the course, you want to learn a little bit more about the myths and prevention, you can watch that too, and that'll be helpful.
I will drop that in the comment section as well for everyone.
So if a pet parent learns from their veterinarian that their dog actually already has been diagnosed with cancer, what is the first thing that you think they should do? And where can pet parents find holistic and integrative veterinarians?
Yeah. So the first thing that they should do is build the team. So the first thing that I think most of them want to do is they are terrified, right? Because they just got a diagnosis. So they're like, we have to act now. Whoever is the first person that can help us, we're going to do it now. And for some people, depending on where you are, it may not matter. You may not have choices. But if you're in a situation where there are options and the pet is stable and is not in a life-threatening situation, I would suggest that you take the time to build your team. So what that means is finding the people that are going to help you achieve the goals. So if your goal is to be aggressive and to really treat this with a curative intent, meaning you want to do everything you can to try to get rid of this, find oncologists, surgeons that are aligned with you. Find a functional medicine or a holistic veterinarian that is going to support everything that they're doing. Make sure that you have a team that's going to work together. Because what we need to remember about cancer is, like we've mentioned before, it didn't just pop up overnight. Even though the symptoms popped up overnight, the cancer's been growing there for years. So we have time to take a deep breath and to find the people that are going to help us achieve our goals in this cancer treatment. Now, that might mean getting a second opinion. That might mean finding a holistic veterinarian who only does telemedicine. That might mean, any other various things, traveling to somebody else who might be a better fit for you. So the first thing that you're going to do is you're going to want to build a team that is aligned with your goals, because not all oncologists are going to have the same goals. Not all surgeons are going to have the same goals. Not all holistic doctors are going to have the same goals. So you're going to find the right team. And then where to find those holistic veterinarians, the American Holistic Veterinary Medical Association website is probably the easiest place to start, because that's where the majority of us list ourselves. The other thing to do is to type holistic veterinarian near me on your search engine and see who comes up and take a look, because in our busy modern life, we want things to be one-stop shopping, but that's not where you're going to get the expertise. I don't even do conventional cancer care anymore, because I was finding that I was spreading myself too thin in each part. And so now I work with the conventional oncologists, let them do their wheelhouse. I do my wheelhouse, and we work as a team, because that's what you want. You want multiple eyes on your pets so that they're all bringing those perspectives to make sure that we're not forgetting everything. Because what happens is that if we're just focusing on the cancer, we're forgetting everything else that's important. So we need those eyes on all the different parts of the field.
I think it's what you just said is actually so important, because a lot of the times, and I see it all the time online, people are like trying to find a veterinarian that's so close to them. I think if you can be more comfortable with the idea of working with a veterinarian that you can speak with online, can be a massive actually.
Yep.
Like sometimes, like, you might have to drive a couple hours to
Yep.
find an integrative vet, or even speak to somebody online.
Do you
Yep.
offer online consultations?
Currently, we're only doing them with other doctors. So if your veterinarian is willing to speak with us, we will speak with you. The other thing that our practice is able to do for people within the United States is, if your veterinarian will sign a form that states that they have a legal relationship with you and send it to us, we can send supplements. So we're able to at least put together a supplement protocol with the consent of your veterinarian.
Okay.
Wow, amazing.
That's amazing. Just one more question of someone in the comment section, Shri Vista. Her dog was diagnosed with cancer, and she is already doing chaga mushrooms, and she's waiting for biopsy. She's on liver tonic from Adored Beast. What are like supplements that you would recommend that she also includes? Not like, she's not asking for treatment advice or anything like that, but just to help support her dog.
So when we're in the period of time where we are before a biopsy and before the conventional treatment plan is established, because the integrative plan is going to be completely supportive and based on that, then you're figuring out what's wrong with the soil. So what did your dog have wrong that led up to this? What are you suspicious of that caused this cancer? And that's what you're going to focus on. Is there history of allergies? Is there history of GI issues? Is there history of inflammation? Is there history of, a processed diet? Whatever you think caused the changes in the soil is what you want to be focusing on now, until you know what you want to do with the treatment plan. Because you're not treating the cancer, you're treating the garden. So what's wrong with the garden that you want to be addressing right now?
All right.
Mm-hmm.
Okay, so I think, yeah. All right, so I think that's all for now. Thank you so much, Dr. Pope, for sitting down with us and answering all of our questions. If anyone has any questions later, just do let us know in the comment sections and we'll get you the answers. But yeah, awesome. So much good knowledge, and we're definitely going to keep watching your content on cancer
Awesome.
prevention. And if anybody does want to sign up for the 8-week course, when does it start actually?
It's going to start actually Monday, a week from yesterday. The intro week will start. We'll be introducing everyone to the membership site, but then June 7th will start and it'll run through July.
Okay, awesome. So this Sunday is going to be the last day to sign up, and then shortly after it already begins.
Exactly. Then all the fun begins.
Awesome. Thank you so much for taking the time.
Thank you guys so much.
Bye.
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 All right. Let's wait.